Democrats crafted the health care law with unions behind closed doors, so my next guest not surprised that Nancy Pelosi is meeting with a union on the day of the repeal vote. Illinois Republican Congressman Adam Kinzinger joining me right now. Do we know what, if anything, is coming of that meeting, Congressman?
No, I haven't heard, but, I mean, the key is this. Obviously, this is democracy. This is representation. Things need to be done in the open. I think that's why people partially were so upset about this bill, not just what was in it, and, the old, hey, we have to pass it to find out what's in it, but because everything was done behind closed doors, and people have this feeling that they're being left out of their democracy, and that's a big thing we have to do as Republicans to restore that bridge between, the folks back home and what's going on out here. And
so Congressman, did you find it odd? I was listening to a lot of the House debate today that it was Democrats who were charging you guys with doing something behind closed doors and crafting a repeal proposal with very little Democratic input.
Well, look, the repeal proposal is very easy, and in fact, we had that with our promise with America. Is basically, look, we're repealing the health care bill, and then we're going to replace it with something that makes sense that we've been talking about both the last couple of years and today. And when we see what all our alternative is, and it's going to be coming out again here pretty soon, people are going to see things like cross-state competition for insurance, real lawsuit abuse reform, not job-killing policies that we saw out of Obamacare.
So then, Congressman, I had Congresswoman Sheila Jackson in Texas here a while ago, and she was showing a picture behind her of a lady who she said whose life was saved as a result of this health care law. The facts didn't seem to support that. It was Medicare that had gotten or cared for something that wouldn't have been affected. Nevertheless, they're ratcheting this up to say guys like you who are supporting this effort are going to kill people. Right.
Obviously, look, they're trying to play the PR game. And I heard them all say, when they came out with this pre-existing conditions thing this morning, the fact is the bill that they crafted never took into account the number of pre-existing conditions they say exist now. I mean, this is getting to be a pretty tough situation where they're just trying to say, oh, my goodness, you're going to take these problems away you're going to take health care away from children. Look, the Republican alternative to this is going to have children being on or young people being on their parents' plans.
Yeah, but first you would repeal it, right? I mean, first it would be repealed, and we'd have a limbo period there where nothing is happening, right?
Yeah, and that's the thing. We'll repeal it, but then we'll replace. Look, we all know, though, that the repeal is not going to happen right away. So you're going to see in my committee, Energy and Commerce and others, where we start to really look at how we can change it, even with the health care law in place. Because I'm going to tell you what, this is bad. This is going to cost a lot of money and add to the debt of our children.
Well, the battle goes on. Congressman, thank you. Very good seeing you.
Thanks. Good to be here.
Well, hey, Republicans, it might be time for you to wake up.